everyone. The following video is to show you how to properly prepare and administer a medication called low-dose hCG. You might first ask, why am I taking low-dose hCG? And low-dose hCG is a part of your cycle to help stimulate the ovaries to produce follicles. So it's a stimulation medication utilized to help stimulate those multiple follicles, whether you might be doing an intrauterine insemination cycle or an in vitro fertilization cycle. With the low-dose hCG, there is another hormone that we have in our body, or I should say the hCG mimics a hormone that we naturally have in our bodies from our pituitary hormone, which is LH. And so the low-dose hCG is similar to that. And that luteinizing hormone works with the FSH to help recruit and develop eggs in our body naturally. So when we are utilizing different medications in an IVF cycle or an intrauterine insemination cycle, we're trying to mimic what goes on with the body naturally. And that's the reason that you might be on this medication as a part of your cycle. It's working in tandem with your FSH hormone medication to help recruit and develop follicles. So that's an important thing to know, is the why am I using this medication. The next thing that you will find is you will receive the following supplies from your pharmacy for your low-dose hCG. And I always like to hold this up so you can read it and see it. You will receive 1 vial of pre-mixed low-dose hCG. And from the pharmacy, it might tell you to refrigerate it, as well as there'll be an expiration date there. So you just want to take note of that. The other thing that you'll receive is several orange-tipped or orange-capped needles with syringe. And this is your medication injection needle with syringe for the low-dose hCG. So to kind of get us started here, that vial of medication that you will receive will look similar to this, and it'll be labeled with low-dose hCG. It'll say to refrigerate before and during usage. And it will also have an expiration date on there. There'll be a little foiled seal. Mine is missing tonight because we're using this for demonstration, but you would take your little foil seal and peel that back the first evening, and you can take a little alcohol prep pad and open that up and wipe off the top of that vial just to clean it good before you poke a needle in there, because that's what you're going to need to do to actually do the administration. A couple little things I'll tell you about the vial is it is pre-mixed, ready to go. So there's no mixing involved with the low-dose hCG, and it's multi-dosed, meaning that you will use the contents of this one vial for your entire cycle. And it will vary how many days a patient might need to be on this. It could be as little as 7 days, or it could be up to as many as 12. But whatever your body needs, your fertility clinic is going to let you know when to start this medication, what time of day you're taking it, whether it be morning or evening or both. They will let you know what you need to do with the timing. They will also let you know how much to draw up each evening or each morning, depending upon how you're taking it. So you always want to refer to your clinic to know how much you need to take, and they will always let you know that. And they'll review, as I'm going to review tonight, the actual administration of the technique that you use and where you're giving the product. They will review that with you as well. So you're always going to find those specifics through the clinic. What you want to know with the syringes that you'll have, usually the packaging that you'll have will come with syringes that will have that orange cap. And this is a syringe that's a very small calibrated syringe, meaning you're not taking a lot of fluid each night from that vial. So it's a very fine needle, very tiny short needle, and it's a very fine syringe that's measured in units. So usually when you are being instructed how much to draw up, the nurses will refer to it in units, but the dosage of how much might be slightly different depending upon patient. So what we would do is we would open up the packaging that has the needle in it, remove that needle, and then we uncap that needle, and you'll see that it's a very tiny needle in length. And then what you do is you are going to pull down on the plunger depending upon how much your clinic tells you to take. So I'm actually just going to pull down, just for sake of this demonstration, I will pull down to the number 20, just as a demonstration, and my needle has a number 20 on it. So I take the little black plunger and I line it up on the 20, the top of the plunger, And that's just having a little air in that syringe first. And what I'll do is when I have a flat surface, but for showing you for the video, I want you to see that we take that needle and poke it through the vial gently, and then turn it upside down, and you'll push the air into that vial. And then you draw back. And I'm just drawing back for tonight's demo, showing you that it's 20 units, but you could be taking 40 units, 50 units, whatever your dosage is, your clinic will absolutely tell you. So I drew down to the number 20. I turn the bottle right side up, and I remove the needle. And right now I'm going to cap it because I'm not ready quite yet for the injection. But then what I do is this vial of low dose, I would put back in the refrigerator, and I will keep reusing from that same vial for each injection. The only thing I want you to keep in mind is to always clean the top of the vial. You don't have to cover it with anything, but every time you take it out to use it, you want to clean the top of it with some alcohol. And usually the pharmacies might provide you the little alcohol prep pads. If they don't, you can use rubbing alcohol and a cotton ball to wipe the top of that. Either way is fine. But I just want you to know it's one vial that you'll use for many nights. In this syringe, we now have what we need for the injection. This medication is what we call subcutaneous. It goes into the fatty tissue. So it's a very small needle that's going in. Usually the places that your clinic might recommend, as with my clinic that we recommend our patients to inject, is either the lower belly, the lower abdomen where we have some fatty tissue, or you can use the upper top thigh or the side outer thigh. There's nice fatty tissue in either of those areas. With this medication, you could self-inject. So if somebody is self-injecting and they're either standing or sitting to self-inject, the angle of that needle is 90 degrees straight into the belly, 90 degrees straight in at the top of the thigh, and then 90 degree even on that side outer thigh. If I can turn this maybe a little bit better to show you, 90 degrees side outer thigh. So it's 90 degrees in. If somebody was laying down for me to administer this shot to them, I would put the needle straight down into the belly this way, or the top of the thighs this way, or it would come into that side thigh. So whatever works best for you, if it's to have somebody give you the shot or you give the shot yourself, it does not matter. As long as you know you do have that as an option, you could self-inject or you could have somebody administer the shot to you. So your steps for administering, and we'll just stand the mannequin up to make it easier for you to see, is going to be that you would wipe the area with a little alcohol to cleanse the skin. Then you are going to give a little pinch. And what I want you to know about that pinching is just, I usually always like to show my arm here because you have a little fatty tissue. You want to just gently lift the fatty tissue up off of any muscle. So what we're going to do is we will give a little pinch to that area, okay, a little gentle squeeze. And then we uncap our needle. And then we don't have to jab. I think the biggest thing I get asked about these little needles is, do I really have to jab in? You do not. Gently place it to the skin. Give a little push. Let go of the fat. And then you can push that liquid just nice, steady pace right in. You might feel a little pinch with the needle, but you really won't probably feel a whole lot. Could you get a little sting when the medication goes in? Sure, but it's very fleeting. And then you want to remove the needle in the same angle that you went in, straight out. And then you might get a little droplet of blood or a little clear fluid. So you just want to put a little pressure there after you get an injection. You don't need to cover the subcutaneous areas typically with any sort of Band-Aid. There's not going to be a lot of bleeding at all from it. But a little tiny mosquito bite pinch is what you may feel. And so I just want you to know that that's okay. Some people will ask if they can put a little ice. We usually recommend you don't even need it with these, but sometimes you might have been ordered a numbing patch, which may have been prescribed for you. So you would apply that 20 to 30 minutes before the injection, just to help with any sort of numbness and not feeling the needle go in. But really the needle will feel just like a little tiny, very fleeting pinch, and then could get a little sting with the medication, but not always. Not everybody feels that. Once you remove the medication, once you remove the syringe and you clean off the little area, if there's any little droplet of blood, you can touch that area and there shouldn't be any residual, anything that you might notice from that. Okay, so keep in mind that the big thing with low dose hCG is it will come pre-mixed, ready to go, in a multi-dose vial that you will use for your whole cycle. However, you will also be given several of the needles and syringes that you need, because those are one-time usage. So you want to use the needles, syringes just once. And when you are done with your needle and syringe, you want to make sure that you will dispose of it in your sharps container that usually is provided to you from your pharmacy to keep all your sharps in a safe area. And oftentimes this will be kept, and it will be reminded through the labeling on there to keep that in the refrigerator during and before usage. And just take a peek at the expiration date. You always want to make sure that that expiration date is not passed. And if there is ever an issue with that, you certainly would want to contact your nurse and your doctor team at your clinic, and they can provide you assistance. And so can the pharmacy if you ever have a question as well about the medication. So hopefully this video was helpful for you to be able to see low dose hCG. You can see that there's only two things that you need, which is the vial and the syringes, and there's no mixing involved. And it is a part of the recruitment process in those ovaries to get multiple eggs when we are stimulating those ovaries for a IVF or an intrauterine insemination cycle. Best of luck to you, and we wish you well.